Today, the joint United Nations program on HIV/AIDS, UNAIDS, in collaboration with the key partners including the Uganda AIDS Commission, provided an update on the country's HIV/AIDS status as of December 2024. According to the report, HIV in Uganda continues to disappropriately affect young females. Of the 1.5 million people living with HIV in the country, 927,751 are women, followed by 528,818 men. The report also highlights 151,907 young people aged 15 to 24, 85,334 adolescents aged 10 to 19, and 70,669 children under the age of 10 as part of the infected population.
Also, stigma and discrimination playing a big role, and we need, as a country, to address and reduce stigma against people living with HIV. And to give them opportunities to also overcome their self-stigma. But also an equal wealth distribution and other discrimination to other social or societal differences, which we all know.
Nevertheless, Uganda has made substantial strides in reducing new HIV infections, achieving 61%, down to 36,648 new infections annually. However, sustaining this progress appears increasingly difficult due to unprecedented shift in global funding priorities by foreign donors such as USAID. According to UNAIDS Country Director Jacqueline Makoka, the ongoing uncertainty surrounding financial support for HIV/AIDS efforts without granting affected countries adequate time to mobilize alternative resources constitutes an irrational decision. She warned that this approach jeopardizes the global goal of eliminating AIDS as a public health threat by 2030.
International HIV financing grew by 12%, with domestic contribution rising. So we are seeing increasingly countries in the low and middle income category stepping up and increasing domestic financing for HIV. And we do hope that, in 2025, when we do the estimates, our projection is that we will see this number grow.
Jacqueline further adds that this will not only frustrate the progress of the fight and preventive efforts, but will also ignite an unprecedented spike in new cases.
Domestic share could rise from 52% in 2024 to 2/3 of the global resource need by 2030. So we are, as UNAIDS, we are encouraging countries, and PEPFAR as well, and Global Fund, we are encouraging countries together to develop the sustainability roadmaps and look at increasing the domestic resources that go towards HIV so that we can meet the targets by 2030.
Dr. Vincent Wagambe, the Director of Planning and Strategic Information in Uganda AIDS Commission, revealed the government is working on a national HIV sustainability roadmap, which will help in addressing the status of HIV/AIDS in the country.
This Uganda AIDS Commission, working with the Ministry of Health and our implementing partners, are working on a national HIV sustainability roadmap. The purpose for this is to be able to transform this response from majorly being donor-led to being domestically funded and domestically led. And this includes many things, including integrating HIV services into other health programs.
The Minister of Health was represented by Mudiope Peter, the head of HIV prevention, indicating how Uganda is registering an increase in people dying of conditions not related to HIV/AIDS, hence urging members of the community to embrace self-care.
We have what we are calling the chronic care model, which depends hugely on the community health system. This model works in a way that when you find an HIV patient in the facility who is not suppressing, who is not getting viral load suppression, or the person's viral load is that high, you follow this patient to the community, attach a community resource person like a peer, a VHT, or a CHU.
According to Flavia Chomukama, the Executive Director for the National Forum of People Living with HIV/AIDS Network in Uganda, decried the limited funding of HIV programs in the country. John Baptista Humza, Church of Uganda, Family TV News at 8.